guys, welcome back to my channel. I miss you guys so much. For those of you who are brand new, my name is Edge. I am a BSN nurse. Yes, I got my BSN, you guys. This channel is mainly about nursing topics, but I also talk about other things like books that I love to read, what I learned from these books. Also, I'm gonna do a little vlogging here and there because I am a new mom. There's so many challenges that come with that, so much excitement, so much and you know, if you're into that, hit the subscribe button, hit the bell, you know, so I can see you in my next subscribe and hit the bell. So I think it's safe to say that we are living in the era of the great resignation because people are quitting left and right. And it's not just those who work in retail or in restaurants and stuff like that. No, people in the healthcare team are also quitting. I can say that for sure because a lot of nurses left, especially where I used to work. A lot of nurses left. I'm one of them. I'm one of the nurses that left. I guess I'm part of the great resignation. Anyways, number 10. So number 10 is inaccurate job expectation. A lot of people come into the field with inaccurate expectations of what nursing is. A lot of people come into this job thinking, you know, it's easy, but most of the time, I'm telling you, I feel like a maid that passes medication. Harsh, but true. Another major thing, a lot of people come into this field, you guys, expecting to be wealthy. I don't know. I don't see a lot of nurse millionaires out there. You know what I mean? Is it possible for you to gain wealth with nursing? Of course. But I think the possibility of doing it as a staff nurse, very low, and you're going to be exchanging a lot of time for money, and there are other things out there. The nursing is not the career choice for someone trying to become a millionaire and stuff like that. It's not it. Number 9 is hostile environment. That's also a big one. A lot of new nurses quit because of the environment they were hired into. I can't stress this enough. When you are being interviewed as a new nurse, you do not need to just be interviewed. You need to also interview whomever is trying to hire you because your foundation as a nurse is crucial. It can either make you or break you. All right, so number 8, we're going down the line, guys. So number 8 is people quit because of the fact that they cannot keep up with the pace. So there are some days in nursing, like when you're like, you know, in the hospital, it's an easy day, chill and stuff like that. But sometimes there are days where, you know, you gotta be on top of your stuff. You have to have good time management skills, and not everyone has that. Another aspect of being able to keep up with the pace, it all depends on the unit you are hired into. I know a lot of nurses, especially now, they're hiring a lot of new nurses straight into ICU. It's not impossible to come straight from school and go into ICU. If I could have done that when I just started, I would have just done that directly. But not everyone can do it because there are some staff nurses that were like med-surg, RN, and then they would try to transfer to ICU and they didn't do it and they just quit and went back straight to med-surg or telemetry. I've seen both aspects where I know this one nurse, actually, she came straight from school, went into the ICU, and she aced it. She killed it. You know what I mean? And she's continuing to learn. Right now, she's a travel nurse and she's doing great. So it's all about your personality, what you can basically get yourself into, how quickly you're willing to learn. And it's not even just how quickly you're willing to learn. It's all about your willingness to adapt, flexibility. You need to be flexible, like extremely flexible in nursing. So number seven reason why a lot of nurses, this one is not just new nurses, this is seasoned nurse, new nurse, PRN nurse, travel nurse, a lot of these nurses quit because of understaffed. When a facility is not adequately staffed, guys, you just don't get it. It drains you physically, mentally, spiritually. I have been a victim of short staff, okay? Like, you're gonna be like, oh my gosh, Edge is so dramatic. But no, I have been victimized by short staffing at different facilities that I've gone to. Normally in ICU, the nurse patient ratio is 1 to 2. PCU and IMCU are usually 1 to 3. And med surge and telemetry nurses in South Florida normally receive 1 to 6 patients. But due to bad staffing, it could be as bad as 1 to 4 in ICU. PCU can get 1 to 5. Med surge can get up to 1 to 8. And I'm telling you, it's draining. So number 6, this one is lack of good management. Because, it's true when they say, a place is as good as their leader. Because whomever's in charge of the unit can also either make or break that unit. There are some units, you nurses know, there's some units you'll go to because management is great. And there's some other unit where management is just laissez-faire and it shows. Number 5. So the 5th reason why a lot of nurses quit is because of the pandemic. Believe it or not, a lot of nurses have health issues themselves, and they don't want to put themselves at a higher risk of catching the disease, and then end up becoming, one of the patients. And unfortunately, a lot of nurses did pass away because of this pandemic. So that one, new nurses, old nurses, a lot of them quit because of that. And it's understandable because your health is your priority. You know what I mean? Number 4. Number 4 was more of a big deal in the beginning of the pandemic, which is lack of protective equipment and supplies. So when the pandemic did happen in the beginning, a lot of facilities ran out of N95s, and gowns for you to wear to go into the COVID patients' rooms. And a lot of people were like, if I don't have the basic equipment I need to keep myself safe, I'm not going into the room. It makes no sense for me to put myself at such a risk of catching something so deadly. It makes no sense to do that. So a lot of people did quit for that. But now it's getting better. Now, I haven't gone to a facility that haven't had enough supplies. But I do know a few people that did quit certain places because of the lack of supplies. And I get that, because at the end of the day, you have to protect yourself. I want to help you, but I got to put my mask on first before I can help you with yours. Number 3. Number 3 is because of work-related injuries. Okay, people do get injured in nursing. You don't just come and talk to your patients and just give medication. That is not it. A lot of people quit because of work-related injuries. So one thing I do notice in the older nurses when I'm working, and it's not just one facility because I work at different locations, a lot of the older nurses, people who have been in the profession for 20, 30, 40 years, they have back problems. And that's not the only thing. I have a list here. Overexertion, falls, slips, violence. Yeah, some patients, might smack you. These things happen. Might even try to choke you. These things do happen. Not as often. I don't feel like people talk about it enough. And a lot of time when these people, these patients who are disrespectful and, and they attack you, I've seen it happen. Management literally will be like, what did you do to put yourself at that position? What did you do to cause it? And anyways, injuries, other injuries that happen, like transportation incidents when you're transporting one patient from one unit to another, exposure to harmful substances or environment. Some of these medications, You should never like try to touch a medication with your bare hands because, you know, especially if you're pregnant, it could be harmful to your baby and stuff like that. So these are other things that, you know, people quit nursing for because, you know, it does cause injuries to be a nurse. The second reason why a lot of people quit staff nursing is because of the burnout, the physical, emotional burnout. Some people, before they come to work, they have all type of physical symptoms, you know. They have diarrhea, they're anxious, they have like so much anxiety just thinking of work. And I remember when I did just start nursing, like when I started nursing, when I just started, at first I was extremely nervous prior to coming to work because I just didn't know what to expect. Every day is different, you know what I mean? But my environment was good. The environment that I started in, it was very healthy. So that facilitated my process. That facilitated my nursing career pretty much. Number one reason why a lot of people quit is because of better pay, you know, sign-on bonuses, travel nursing. The ultimate thing is better pay, okay? Better pay. Money talks. Money make people move. Money make the world go around. For two main reasons. Travel nursing, because especially right now, travel nurses make so much more than staff nursing. Some people can make up to like 10 times more than what you were making as a staff. Some people can literally make what they were making in a year in 2 to 3 months. You know what I mean? That's that's pretty good. Only thing is you're gonna be taxed way more because, you know, you can't escape that. Another reason why too people quit is because of the fact that when you start brand new, like in a new facility, there are sign-on bonuses. So pretty much when you are a staff nurse at one facility, you quit and you go to another facility, a lot of places give you sign-on bonuses. Some places will give you 10,000, 20,000 sign-on bonus for you to stay with them for a year or two, and then when you sign it, you agree, you'll get your money and you got to do that time. You know what I mean? And a lot of people do that. They'll go from facility A, get the bonus, quit after the 2 years to go to facility B, and then they come back to facility A. And another thing too, when you stay staff in one facility, your raises are like, you know, 1 cent, well, not 1 cent, but like 15 cents, 25 cents. And then when you quit and you go to a brand new facility, let's say from facility A to B, you can get like a good $2, $3, sometimes $4, $5 raise plus a sign-on bonus of 10 to 20,000. And that costs some people, you know, they're like, okay, that's good for me, you know. But some people, they'll stay because of the benefits that come with facility A, and they're like, if I leave too soon, I lose my benefits, because that's another way hospitals try to keep you, you know, loyal, I'll say. But yeah, these are the top 10 reasons why a lot of nurses are quitting. This was lovely, you guys. It was great to see you again. I hope I get to see you next time I post a video. Mwah. Hit the subscribe button if you haven't done so. Hit the bell if you want to get notified every time I post a video. See you guys next time. Stay awesome.